Well, I think things have changed considerably over the last 12 months with COVID in particular. And there's been an enormous demand for elective procedures at a time when acute hospitals are challenged with COVID patients. And after the first lockdown, obviously, we figured that we couldn't actually do the elective cases. But I think from the time of the second lockdown in our country and in many other countries, we realized that it's a ticking time bomb to leave a lot of these elective cases on hold. And clearly, you can't leave them on hold forever. So, not just IR, but for other specialties who have been involved in ambulatory care or day case surgery, day case IR, whatever you want to call it, they have ramped up their access to day case surgery, putting patients through that perhaps would not have gone through this before. So we have an opportunity, I think, really to relook at IR, relook at how we do things, and push towards doing more ambulatory care, day case surgery. I think we'll be pushing an open door. So I would encourage you all to actually at least look into it and at least join the webinar and hear from the experts. The main thing is the patient. So if you look at what's happening in hospitals now with access to hospitals being limited, with patients worried about COVID, with worried about coming into hospital, worried about spending overnights in hospital. So from a patient perspective, this makes intuitive sense that they come in the morning and go home in the evening to their own home for their post-operative care. So that's the first thing. I think patients like it, patients want it. And then the other benefits obviously are economic in terms of overnight stays in hospitals are very expensive, more expensive than five-star hotels in many cases, particularly in our country. So, from an economic point of view, from a patient pathway point of view, these are all very, very positive things and huge advantages for day case over inpatient care. It's a little less complicated for us because so many of our procedures are suitable for day case IR. Those of us who have been doing it for a long time realize this and are pushing more and more patients through day case IR because of ease of access. But it's not universal, and I think this is where we need to actually push hard to kind of put our foot in this particular door and try and open the door, so to speak, for day case IR. So I don't think it's more complex or complicated. I do think you need the resources in terms of nursing, clerical, in terms of the organizational aspect of it, and obviously access to day case beds. But I think we are pushing an open door, particularly at this time. So it's a good time to actually approach it. We have a very wide spectrum of experts talking about ambulatory care, from a vascular surgeon to interventional radiologist. We are going to go through the whole process in terms of how to set it up, what's the science behind it, what are the guidelines that are out there currently, what is the economic impact for your hospital, perhaps how you can approach your hospital in terms of actually getting this across the line. We're going to talk about a center in the UK, or we're going to hear a talk from a center in the UK also, who've been doing this for 20 to 30 years. And importantly, we're going to hear also from a nursing perspective, what this means, what it entails. And the whole process in terms of resources, infrastructure. So I think it'll be very useful for people who are interested perhaps in approaching their hospitals to try and set up a day case or ambulatory care IR service.